Please welcome Ms. Anna Molotkova.
Hello, my name is Anna Molotkova, and today I will be presenting on Nano-Structure mediated delivery of a chemotherapeutic agent bosutinib for improved chronic mild leukemia treatment. Chronic mild leukemia, or CML, is a slow progressing blood and bone marrow disease where the bone marrow overproduces abnormal granulocytes, which are a type of white blood cell. These abnormal granulocytes then accumulate in the blood and bone marrow, leading to many complications and, if left untreated, death. The majority of chronic mild leukemia cells have a translocation between chromosomes 9 and chromosome 22, forming the Philadelphia chromosome. The Philadelphia chromosome contains the BCR-ABL oncogene, which produces the BCR-ABL protein, a tyrosine kinase that is responsible for the uncontrolled proliferation of CML cells. Currently, the first line of treatment for chronic mild leukemia are tyrosine kinase inhibitors, which bind to the ATP recognition site of the BCR-ABL protein, preventing phosphorylation and stopping the signal cascade that would lead to the chronic mild leukemia cells proliferation. In this study, I used bosutinib, a second-generation tyrosine kinase inhibitor, which is effective for almost all patients with CML. However, it still shows significant side effects to the rest of the human body. The purpose of my project was to use gold nanoparticles capped with carboxymethylchitosan as a platform for the delivery of bosutinib, in order to increase bosutinib's efficiency at killing cancer cells while decreasing its cytotoxicity to normal human cells, thereby leading to an improved chronic mild leukemia treatment. My project was divided up into 3 phases. Phase 1 were baseline studies of bosutinib, Phase 2 was gold nanoparticle synthesis and conjugation, and Phase 3 was an evaluation of this novel chronic mild leukemia treatment. So first, I looked at different concentrations of bosutinib and how K562 cells, which are chronic mild leukemia cells, and HFF cells, which are human foreskin fibroblast cells, they're basically normal human cells, respond to bosutinib. As you can see, as the concentration of bosutinib increases, the viability of both cell line decreases. I picked 30 micromolar as the concentration of bosutinib to use in my continued studies because it caused the most significant cell death for both leukemia cells, thereby providing a platform to build upon and improving the treatment, and also caused the most significant normal human cell death, providing a good comparison to see if the cytotoxicity is reduced. I also looked at the mechanism of action of bosutinib. For the normal human cells, you can see that as the concentration of bosutinib increases, the levels of apoptosis in the normal human cells increase as well. However, for the leukemia cells, there is a very negligible increase in apoptosis, indicating that bosutinib must be acting solely by inhibiting cell proliferation instead of also directly inducing apoptosis. This has been supported by many studies that tyrosine kinase inhibitors only inhibit cell proliferation until you reach high enough concentrations. Here it will be shown to be 30 micromolar. I then synthesized gold nanoparticles by using chloroauric acid and capped them with carboxymethylchitosan. I used UV visible spectroscopy to confirm the presence of the gold nanoparticles in the solution. As you can see here, there was a peak at 527 nanometers, which typically indicates that gold nanoparticles are present. I also wanted to visually confirm this, so I performed transmission electron microscopy, and at a high magnification, you can see the gold nanoparticles have a typical spherical and dense morphology, while at a low magnification, you can see that they are present at a relatively high concentration in solution. I then looked at the particle size. I used ImageJ software and sampled 111 gold nanoparticles, found the highest frequency to be from 23 to 34 nanometers. The mean size was calculated to be 27.7 nanometers. I then used a zeta sizer to look at the size distribution curve of the gold nanoparticles. The peak was found to be at 30.3 nanometers, again very similar to what was found before. The size of 20 to 30 nanometers for gold nanoparticles has been found by many studies to be an ideal size for drug delivery applications. I also looked at the zeta potential of the gold nanoparticles, which was found to be negative 46.0 millivolts, and this slightly negative surface charge of the gold nanoparticles is also characteristic of them. I then looked at the stability of the CM chitosan cap gold nanoparticles, as if they entered the body and were to be a viable treatment, they need to be stable in a variety of conditions. I looked at different electrolyte conditions. Here I used sodium chloride 10 to negative 1 molar to 10 to negative 6 molar, and also looked at pH ranges of 2 to 12. As can be seen by the UV visible spectrum, there was no significant shift in peak, change in absorbance, and no aggregation of the gold nanoparticles observed. This indicates that the gold nanoparticles are in fact stable in these various conditions. I then looked at the biocompatibility of the gold nanoparticles with both cell lines. For the normal human cells, you can see that the gold nanoparticles do not cause a statistically significant decrease in cell viability. While for the chronic mild leukemia cells, you can see that the gold nanoparticles do cause a statistically significant decrease in cell viability, which may be due to the gold nanoparticles interfering in the cell proliferation mechanism in some way. I then conjugated the drug